Hi, Dr. Berardi, and we had a question about how long do I need to take off work after surgery? So that, it varies really. It depends on what type of surgery you have, whether it's breast, body, or face, and depends on what type of work you do. Now, as a standard, I typically say plan on taking 2 weeks off and go back to work early versus not taking enough time off and having to call in sick. So typically there's going to be with body surgery, typically there might be some physical restraints. And with facial surgery, it's going to be mainly ability to be socially presentable. So again, it depends. I tell people that you take the 2 weeks, you go back early versus if you go in and you say, I feel great, I'm going to go back to work. The one unexpected thing that people will encounter is just a complete energy drain. So every day, let's say you eat 3 meals a day. That helps you walk, talk, breathe, you name it, perform your daily activities. And when you have surgery, you have a pretty significant calorie demand for the healing process. So you say, oh, I feel great, and the moment you go back to work, you feel like you have to lay down. So I always prepare patients and say, look, it might take you longer to recover than you expect, but make sure you have the adequate amount of time off, because if you don't, then you're inconveniencing your employer or your employees where you have to call in sick. So highly variable, but for most of my cases, most of my surgeries, I say take 2 weeks off, you go back early. Stuff like breast augmentation, I still recommend that. However, in all likelihood, after a week, you're okay to go back to work as long as it's not physically demanding. So any questions further about that, especially when it comes to a specific procedure, just give our practice a call. We'd be happy to talk to you.